welcome. If you're just coming in, we have a poll question up. If you'd answer that, that'd be great.
All right, great. So answer the poll question, and again, welcome. I'm Steve Kramer, President and CEO of the Minneapolis Downtown Council, and you're joining us for our program on back to the office, operating under the influence of COVID-19. Hope everyone is staying safe through this time. We've had this kind of combination of the health pandemic, COVID-19, and then of course, since Memorial Day and the death of George Floyd, the challenges to our community, and this program represents our return to the COVID-19 topic. Last week, we hosted a conversation with a number of prominent leaders in our Black community, which was very powerful. So I think this dual track of responding both to the community issues as well as the public health impact on the reanimating our downtown will be with us here for some time, and we're looking forward to a really good conversation on this other topic. We do continue to collect information about COVID-19 and reanimating the economy downtown, and that's located at our website, mplsdowntown.com/COVID-19. So feel free to access that yourself or pass it on to your colleagues and clients. And with that, I'm going to turn it over to Mary Beth. I think we've got maybe some poll results and a few other announcements to make before we get on with the program.
Right, yeah, I think we do have some poll results. If Dana could put those up. Oh, okay, so there's 32% of the folks here are already back to the office, which is
that's great.
Yeah, and then what do we miss the most? The bustling atmosphere. I miss the Skyways. Thanks for answering the poll, everybody, and I just want to go over a few housekeeping items before we get started. We are at the mercy of our Wi-Fi connections and technology, so we appreciate your patience if we have any glitches. And the conversation will be recorded and posted on our YouTube channel if you'd like to share or watch later. As we kick off the program, please do feel free to introduce yourself in the chat with your name and your company. We'd love to hear from you and know who's with us today. And then if you have any questions throughout the program, just use the Q&A function, and I'll be watching that and helping to facilitate Q&A at the end as time allows. And I'm going to hand it back to Steve, who will share some information about some upcoming programs that we have.
Great, thanks. We do have a couple of additional programs coming up tomorrow. A session on sponsored by the New Partners, which is a group of businesses over in the area of Target Field that have been meeting for many, many years to nurture long development in that area, triggered by the Great Target Field project. And they will be talking about the Root District, which is an exciting new kind of aspirational approach to redeveloping the area around the farmers market and environs in that vicinity. And then on July 18th, we'll have a third in a series of Back to Business, and more details will be available on our website and through other communication mechanisms here from the Downtown Council. But the basic theme of that session will be to try to talk to a few markets that are maybe a little bit ahead of us on the COVID-19 curve, although that's becoming a more murky situation all the time, about what their experience in bringing life back to a downtown central business district has been. So tune in for more details on that topic. But today we have a really great panel, and let me introduce them, and then I'm going to go person by person and ask an initial question to get into the dialogue. And please use are we using the chat or the Q&A function for questions, Mary Beth?
We're using the Q&A function for questions,
okay.
But people should feel free to use the chat to introduce themselves.
Okay, great. So our panelists include Dr. Heather Huseby, who's the Executive Director of YouthLink, Matt Kucharski, who is the President at Padilla, Brent Robertson, Managing Director for JLL, Breanna Schafer, Senior Director of Government Affairs at Target, and Tanya Spaulding, who's a principal at Shea, Inc. And behind the scenes, we have Dana Grady, who's our event coordinator at the Downtown Council, and she's helping with kind of the behind the scenes logistics, as I mentioned. So let me start, Breanna, if I could, with you. Target, of course, is such an important actor in our downtown economy. So could you share with us a little bit how Target has been approaching kind of this remote work and return to office, and how you're kind of planning for the coming months in downtown?
Certainly, yeah. Thank you, and appreciate the opportunity here, Steve, to talk with you and a variety of community leaders here today. As a large headquartered company with thousands of employees, our leaders recognize that no situations are the same. That said, there's a few principles that are universally guiding our work as we think about returning to work and what the next few months are going to look like. First, the top priority for us and many, probably all businesses downtown will continue to be the safety and well-being of our team. So we're in the middle right now of developing plans and have been over the last month or so, 2 months, in close partnership with a broad network of medical experts, industry peers, and authorities. As our team starts to phase back into the office environment will look and feel very different. Our team members, before coming to work, will be doing home health checks. When you're at work, team members will be wearing face masks. Our workspaces are going to be reconfigured. We'll be having limited common spaces and services. And at Target, we have our great hall, and we have a lot of places where we usually work in really collaborative environments. That's going to have to be different for the time being. There's more physical distancing that we're doing, including elevator metering and limiting gatherings and meeting sizes as we look to the future. All of that is going to be a part of the new reality. To your question about timing, we are gradually phasing in, and there'll be a bit of a blended approach of working at our downtown or at our headquarters locations versus working remotely for the remainder of the year. Soon, within the next month or so, a small percentage of our team members are going to be coming back to headquarters. Those team members, really, their work is dependent on HQ facilities. But for most of us, we'll be working in that blended model for the next several months. But I think the one thing that we've learned a lot is that technology is our friend, and we've been able to learn a lot and still stay connected through things like Zoom, and thanks to Zoom. We've been provided additional resources even to set up our home offices, and know that what these work environments and the flexibility that we've been allowed and provided as we've had to work through the differences, we'll continue to work in that way, and we'll go beyond the next several months, that flexibility, and probably more working from home, more blended models. I don't know that we'll just go back to how it always has been before. I think that there'll probably be a little bit more of a mix and flexibility moving forward.
Yeah. That's so consistent with what we've been hearing from a cross-section of downtown companies. We've been hosting some calls with HR leaders, including some of your HR leaders, and very consistent message. How's remote working been for you personally?
Personally, good and bad, right? I live in White Bear Lake, and so I don't have the long commute, and it's been so nice to not have traffic a part of my everyday life. That said, I also have come to realize that the commute home sometimes is really helpful. It creates a bit of a space for me to stop thinking about the last meeting or the last email that I was just doing and get ready to enter home where I have a couple of kids. And now it's just 10 stairs down into what's for dinner and what's going on. And so being able to find those spaces for boundaries has definitely been something I've needed to learn.
Yep. Workday never seems to end these days. So, well, thank you very much for that. And we'll come back to some of the work that Target's been doing around kind of sharing your experience with retailing as well, which is very exciting. Brent, maybe you could talk a bit about kind of the JLL office, and then kind of what you're hearing and what you're saying to your clients right now, kind of both folks who are in offices in downtown Minneapolis and folks who might want to come into offices about sort of the current environment.
Yeah, absolutely, Steve. Happy to do it. And I am downtown today. I'm happy to be downtown. Luckily, when this thing started, we shut our office down March 16th, like a lot of people did. And I've been on weekly global leadership calls within JLL since then. And it's been great because we've had our offices in Europe and Asia, Singapore, Hong Kong, checking in, telling us how they've been, because they're 2 months ahead of us. Right. And I can tell you, in Asia, at least from JLL's perspective, our Hong Kong office is open. Our Wuhan office opened a month ago. Our European offices are opening up. A lot of them are opening up with A and B teams. And that can take different forms, but A team 1 week and then the B team the next week with a deep clean in between over the weekend. And specifically for our office here, I tried to open the office May 18th. And the language that Governor Walz had in his orders, and I think he might still have it, it says, regardless of your essential, if you can work from home, you must work from home. And that word must, I've talked to a lot of colleagues, that word must really put made us think twice. So I pushed it from May 18th to June 1st and eventually June 15th. So, and today I'm here. We have, our office is 11,000 square feet, 47 people. I opened in phase 1 of 3 phases. And that was really kind of the essential workforce, which is about 12 people. And today, it's been light. I'd say since last Monday, we've had no more than 6 to 8 at the most coming in and out of the office. But we have the protocols in place that Governor Walz demands, and we have those posted. Checking your temperature and everything. So it's been great. It's as you know, Steve, it's quiet, but there is something about being back in the office that makes, at least personally, myself more productive. Yeah.
Is that a similar message you're hearing from some of the who to try to get them into offices, or what's the general perspective that you're hearing from your clients?
So candidly, the general consensus is they're saying to Brent, what should I do? And how can you help? So our project development group is actually helping a ton of companies who just don't know what to do. Should I reopen? Should I not reopen? So what we're doing is basically we put together a questionnaire as a third party. Now we get more candid feedback from the employees of what they want, and we're tailoring reopening plans based on that feedback. And it's a total mixed bag, Steve. There's some companies that are saying, Brent, we don't even want to do this survey until January, and there's other ones that are like, let's go. We want to get that culture back as fast as we can. Yeah, great. Thanks. Well, I think we'll revisit that topic as well. So thanks for those initial remarks. Dr. Heather, important part of the downtown environment certainly are social service and human response agencies like YouthLink, and I know you've had to go through a mention as well in response to COVID-19. So, a bit about kind of what the last several months have been for YouthLink as you've tried to maintain those critical services to young adults who are homeless.
Thank you, Stephen. Thank you for having me on the panel. YouthLink is located downtown in our central, actually our central services is the downtown area. And for all of you that I think most people know, but we serve youth that are homeless, and our population is 18 to 24, and most of the youth really consider downtown their home. So when the COVID-19 pandemic hit, we did not close, and we really couldn't close because the population of youth really looked to YouthLink for their services. What we had to do was really look at our core business model and take actually the instructions that we were getting from CDC and Minnesota Department of Health and apply that to our essential services for the protection not only of our staff, but also the youth, because the youth population that we serve are among the most vulnerable population for COVID-19. And so we applied that to the services, and we had to make some pretty significant changes, which for us, the youth used to come to YouthLink and be able to pretty freely, they would register, but then they would come into the drop-in, and they would have access to being in the drop-in. And part of our philosophy is to develop a trusting adult relationship. And we would do that, in a very intimate way. But we had to change all that. And so youth had to come in and go through a process, have a temperature check, have screening. We had to limit groups, they couldn't, the social distancing, meals, which were a huge part of our drop-in. We went to packaged meals. They were delivered to them at the door. We also have 190 units of housing. And so we had to isolate youth in their housing. And our staff had to also become more providing our services virtually. And so that touch point of being relational kind of went out the door, and we became more providing services in a virtual way. One of the things that for YouthLink as a nonprofit that we struggled with was even getting some of the PPE gear. Now, we were really fortunate because there was a really a push to provide a lot of services to us in PPE gear and emergency support. So we were really fortunate of that, and we got all of that. So we really have integrated that. The interesting thing, we were an essential service, so we had to be open. Our workers were essential services, so we had to be open. The interesting thing that we are finding is that we learned some things over this. First of all, the youth that we serve, even though we went virtual, didn't have computers. They don't have laptops. They don't have iPhones. They don't have iPads. So we had to provide those for them, and that was one thing that was difficult. The things that we've learned out of this is that the mental health needs of youth were increased. So we've increased our services in mental health. But the one thing that we've learned is that virtual services have really actually increased, and they've been effective. So as we continue to look at bringing things back, and I'll talk about that a little bit later, we've really done a deep dive into how we deliver services. And I think that's going to be a change with the way how we work with youth. So that's kind of how we've adapted things, and we're continuing to look at that in the future of how we provide services.
Great. Heather. I actually, at some point, I want to come back to all of you and explore how durable this remote work or remote service delivery trend is going to be, but we'll get to that here in a second. Matt, Brent mentioned that one question he gets a lot from his clients is, what do I do? And Padilla has put together a return to work playbook. So could you talk a little bit about that and what you're hearing and what you're advising folks that you work with on this return to work question?
Thanks, Steve. Thanks for having me be part of this panel. It's actually been really affirming to hear Brent and Breanna and Dr. Heather speak, because we're going through the same thing, and we're in a kind of an interesting position at Padilla where we need to be thinking about our return to work at our own office, our 6 offices across the U.S., as well as we're being asked to help clients communicate expectations both internally and externally around this. And as we started working on this with our clients, we realized that there were some fundamental principles, as Breanna brought up, that we really needed to be thinking through, and our clients need to think through. So this is just a very simple, logical process that we've been repeating with our clients, and it's in you all have it, and you can certainly send it out to whomever might ask for it. It starts on the left to right. You have to actually think about asking the question, should we re-enter? And return to work, return to office. Notice it doesn't say return to normal, because that's not happening. But should we re-enter? And with then we have to look at what considerations and decisions are going to drive that, because there's internal considerations like the poll you just conducted. What's the mindset of our employees? And by the way, just like Brent and Breanna, we're at a third. About a third are ready to come back now. A third said, we'll wait until we're really sure that things are safe. And a third said, you know what, I think this is the way I'm gonna wanna work for the long term. So we have to consider those internal. Externally, we have to look at state guidelines. We have to look at, is there a new spike, availability of PPE, other kinds of things like that. Those two things, internal and external, have to drive it. That then also, though, needs to be matched with your organization's principles and values. Where does safety fit in your values? Where is customer service and client service? How important is collaboration? How important are, you think about all the different things that drive your organization. They have to align with this. It's not just get back to work as quickly as possible. It's where do you sit as an organization? And then Dr. Heather brought up something really important. Some of what you're going to do is going to return to normal. Some of what you're going to do is going to be a completely new normal. There's going to be some things as we return that are not going to go back to the way they were. And you have to deliberately think through which of the things that we were doing before do we want to bring back, and which of the things are going to change because this is a great big catalyst to us doing some things differently. Those two things then drive your integrated plan. That plan has got both actions, the things you're going to do, and how you're going to communicate as you do decide to come back. And by the way, just like Brent and Breanna, we're coming back in phases, and you have to be thinking through how that phase will work. As we do that, we have to think long term though, because this is really as life-changing as these events have been, we have to be thinking through what we're going to look like and how we're going to serve our customers and our clients, and what kind of employee experience are we going to provide over the long term. And that long term isn't 2021. That long term is 2023, 2024, and thinking through that. So it's very logical, but it also helps us make sure that we're not jumping right to what are we going to say. It's thinking about what are we going to do first.
Yeah, no, that's helpful. Thanks. One thing we've heard from some of the companies we've been talking with, to your point about it's not going to be the way it was, is even coming back to the office isn't going to be the way it was, right? It's
right.
You probably can't make coffee at the coffee machine, bring in your own.
People are really upset that our brand new espresso machine is sitting idle. I can tell you that right now.
Right. That's part of the communication process. Kind of what are your expectations for coming back?
Right.
So, which kind of leads me, Tanya, to you. I know Shea works with a wide variety of clients, including office clients. So you may want to comment on that as well. I thought one of the tips I saw from you is to use a lot of bleach, because when people watch into the office, they know you're taking care of the cleaning issue. That was brilliant. But you're also known clearly for your work with restaurants, and that's such an important part of the downtown environment. Maybe if you could start your remarks with how you're kind of working with the restaurant industry, because they're sort of the latest on the turning of the economic dial to start coming back. And I'd be interested in your thoughts on how that industry is adapting to the current situation.
Sure, absolutely. Thanks, Steve. And I've been the one that has actually been here all along. So our office at Athan Hennepin, and I live in the North Loop, so I've been here since the light switch shut off until it started to reopen. So one of the first things that we did, because we do work in consumer environments across platforms like workplace, hospitality, and retail. So we, after the initial shock of those second couple weeks in March, we kind of took the approach to spring into action. And we said, let's start being proactive for all aspects of consumer businesses and consumer spaces. Let's start preparing, because life will return. We don't know when. We didn't know when in March. We knew even less in April. But we were encouraging every one of our clients to not sit on their hands. So particularly in the restaurant industry, their lifeblood is having guests in their spaces. So to use that time productively to start preparing their spaces and preparing what their experience was going to be when they did come back. So it was exactly right. Bleach is a word that we used a lot. So we began publishing a lot of content for all of our clients in all aspects of consumer spaces, basically telling them, don't sit on your hands. Let's not live in fear. Let's start preparing however we can to get back to our spaces. And a lot of that was cleaning and decluttering, whether you're a workplace or a restaurant. Deep clean it, sanitize it, get rid of old and broken down pieces of it, bring up your lighting. Take this time to do the maintenance that you need to do regardless of who you are. Disinfect and just really make the place sparkle. And if you're a restaurant in particular, don't just turn off the lights and send your people home and leave the old food in the refrigerators. Don't wait. Let's be proactive. First of all, it makes people, I think, feel that they're working towards something productive. And secondly, when we did start getting the orders that we can do indoor, outdoor dining, reopening dates, they were ahead of the curve. In addition to that, starting to encouraging different revenue streams, particularly for the hospitality industry, the take and bake meal kits, the takeout options. We worked with them to try to retrofit entrances into takeout windows, putting tents on the outside of their building to make people comfortable when they did the curbside. So it was both, how do you prepare for the longer term, and then how do you adapt and increase your revenue streams for right now? Because I think it's just sitting at home waiting is hard for all of us. So we really took the approach of, let's use this time, let's be productive, let's be proactive, and let's start getting our spaces in shape. And a lot of our restaurant clients in particular are very appreciative that they did spend that time wisely, because now they're a bit more ready to go than others.
Yeah, makes sense. Thanks. Great. Well, we'll come back to some of those issues. Brent, let me go back to you and ask about the Safe Retail Initiative. I mean, Target obviously has been a lifeline, not only in this community, but across the country during this period of time for people who need basic goods and have their needs met. And so you've learned a lot about how to operate retail in this environment. So could you say a little bit about the Safe Retail Initiative and what led to that and kind of how you're rolling it out?
Yeah, absolutely. Thank you. I'll begin just by sharing a few of the realities in which safe retail is grounded. And the first, we've, as a government affairs person over the last several months, we've been investing heavily in building and maintaining trust with our team members, our customers, but also in my role with elected officials and elected leaders at all levels throughout the pandemic. We've also been operating, as you mentioned, in all 50 states since the pandemic started. We were very early considered an essential retailer. And so how could we continue to operate in a safe environment and adapt to the variety of emergency orders coming out from different governors, county executives, even at the city level? And it seemed for a long time, and sometimes still in a way does, that every city has its own set of requirements that require us to uniquely adapt our store to what's going on locally from a health perspective, while also making decisions overall that we want to make sure are consistent in the Target store environment. But as we've been learning throughout this, we haven't gotten it all right to begin with, but we've made adjustments as we've gone. And now, as other retailers and as other small businesses have an opportunity to reopen, we recognize that we got to learn and adjust over a period of time as the pandemic was working its way through communities. And now people, leaders of businesses, are having to make all of these adjustments all at once in order to be able to reopen and be able to have their employees come back to work and serve their customers. And so from that perspective, we built out Safe Retail. But what is it? It's a resource available to any business that is thinking about how to operate differently for some time into the future. It includes processes and tools that became necessary for Target along the way for us to continue our operations by prioritizing public health and employee and community safety first. But it's not just an overview of what we've done. It goes further. We wanted to make this really practically worthwhile for a business. It includes kind of plug and play templates and guides, and we've de-targetized, if you will, all of the content so that it doesn't have bullseyes all over it. We call our customers guests. We call our employees team members. We've removed that jargon and made it much more general so that other companies can take it and use it. So we'll quickly just page through. I don't have it's a 60-page document. It's quite comprehensive. I've just pulled a few pages out, and I think the visual helps describe a little bit more for participants here today what this exactly is. So SAFE is an acronym, as you can see here, that stands for screening, access, face coverings and protective equipment, and then enhanced safety measures. And we've kind of pooled the different decisions we've made under those categories and then walked through what we have done. So if you want to scroll to the next slide, one of the things that we have done is promoting just healthy shopping behaviors overall and posting signs in the front of our stores as a note to our customers. For us, it says note to our guests, but like I said, we scrubbed all of these and put note to customers about the coronavirus. What you see here, there's no bullseyes on it, and it's just an attempt to remind people before they come in to just stop, ask themselves a few questions to help with that screening before people enter into your building. If you click to the next page, there it is once again, and it's actually in a printable size so that you can literally take it, print it, post it, knowing that a lot of the small businesses might not have the graphic design teams that Target has or the time to be thinking about what should be on this sign. They can literally just print it and post and focus on the things that are most important to their business and getting people back. If you go to the next slide, that's the second sign, again, printable. Next slide. We decided to proactively provide certain hours to vulnerable populations to access Target stores so that they had a shopping environment where they felt more safe. And so in the front of our stores, we made sure that the public was aware of what these vulnerable shopping hours were when they would take place. And so our stores team would kind of put their hours in because in certain locations, store hours needed to adjust for their local requirements. And so they put those in and posted them. So again, if you click the next couple those are just the examples of, you can print it yourself, post it yourself. There's no bullseyes on it. We also went through another example under the enhanced safety measures is more rigorous cleaning routines throughout our stores, and that's been ongoing. But what does that look like? We included here what our staff cleaning checklist looks like. And so if you're thinking about what sorts of measures should you take to have more safety protocols and cleaning protocols for your operation, here's what we've done and what we do. You can, again, print this and post it at certain places for your employees to know what they need to do and how often they need to do to go through and clean the store. I'm going to click through. Again, here's where it just becomes really easy to use it. Can print it, no bullseyes, removing target jargon. It's a long checklist, as you can see, how we're thinking about what cleaning looks like in a retail environment. Also, for social distancing, another enhanced safety measure that we included in our playbook were reminders that we would play overhead so that our shoppers could be reminded to stay within or further than 6 feet apart from one another. So this was just the example of what we said over the loudspeaker if others were thinking about doing something similar. And then when we, as the pandemic evolved and more health data came back saying face coverings really do make a difference in fighting the spread of COVID-19, then we updated that reminder to also include a reminder to wear face masks. Next slide. Finally, I think this may be the last example that I pulled for purposes of our conversation, but there's many more included in the toolkit. We designed a social distancing playbook that we've shared out to all of our store leaders. And in the playbook, it is a reminder of the things that we're doing as a company to enforce social distancing. And it includes signs, again, that are posted at different places. It's instructions on where to put those little signs that are at your feet when you're approaching registers that keep you the 6 feet away from one another, how to get those, where to put them, where to actually place them down next to your registers. And so it's the instructions along with the signs. And if that's a useful tool that others can use, we wanted to make that available as well. So that's kind of just the overview of what Safe Retail is. It's been downloaded many times as we've shared the content. We're really, again, we feel really grateful for being able to operate throughout the pandemic, and we've learned so much, and Target cares so much about the communities that we are in, and we know that businesses rely on each other to be successful. So our hope is that not to say that this is the best practice, but rather a list of considerations that you can adapt for your own work environment, for what works for you, knowing that every retail and business has to do it their own unique way. So hopefully bits and pieces of this can be valuable for other companies across the city.
That's a great resource. Thanks for putting that together. And people can find that where? Just download it from Target.
Yeah, we can send it. I'll just put the link in the chat here if that works. And then also if you go to Target's, it's a bullseye view, and we have the resource available there.
Great, perfect, great. Thank you, Breanna.
You're welcome.
Brent, let me come back to you. Many of your office tenants are in multi-tenant buildings, and so there's this sort of interesting interaction between what companies themselves and offices like your own office are doing to make sure workers feel safe, and what buildings themselves are doing in common spaces or in elevators and other places that people need to traverse to get to the office. And what are you hearing from your kind of building management colleagues about how that work is progressing, and what are some of the issues you see there that we need to make sure we stay on top of?
Yeah, just pulling up my notes here. That the three main areas outside of the multi-tenant office tenant space that are common are really the elevator banks, bathrooms, and lobbies and amenity centers, conference centers. So I'll hit elevator first. Basically queuing, social distance queuing. So pretty much all the multi-tenant office buildings have, puts X's on the floor to make sure passengers are socially distancing when they're queuing. Majority of elevators that I've seen are saying 4 passengers per elevator. And I know specifically that's going to be, once we ramp up here and more people come back to the office, it'll be an issue. Candidly, I don't think I've ridden in the elevator. I'm on the 30th floor at PwC Plaza here, and I don't think I've ridden the elevator with anyone in the last 2 weeks. So handrails, call buttons, those are being obviously cleaned. Everything's being cleaned. But specifically, it's the two things are the queuing, socially distance queuing for the elevators, and then 4 people per elevator. Bathrooms are the kind of the toughest part. You just got to be, building owners are advising to wear masks, but I mean, candidly, I don't know of a building owner that's monitoring that in a multi-tenant scenario. But, obviously cleaning and touch points, everything is accelerated and increased. That's really the only thing they can really do for a multi-tenant standpoint with the restrooms. One thing though that came out of it is we're working with Hines on the new North Loop Green building, and we're talking about now having doors on either side of the restroom so you could go in one way and out the other in the event of a pandemic. Something, very few office buildings offer that right now. Yeah. And then candidly, the amenity centers, conference centers, fitness centers, they're all closed right now. It's just very difficult to maintain social distancing in. All the furniture has been put away. Coffee bars have been closed. As soon as we get farther along and Governor Walz opens things up a little bit more, I think that'll come back. But right now, candidly, they're just shut down because there's not the need, and it's just very difficult to monitor. Yeah. Oh, thanks.
Dr. Heather, you mentioned street outreach, and that's kind of been a staple of YouthLink's work. How has that changed in this time? You mentioned virtual work. Just say a little bit more about that aspect of YouthLink's mission. Dr. Heather, you with us? This might be one of those technical glitches that we've talked about.
No, I think I got it.
Okay, there we go.
Yeah. Street outreach has always been, part of our work. And actually, during the heavy part of COVID-19, there was actually a period of time when we were not going out, but we returned to that. And actually, one of the major, I wanted to say that, just to kind of raise above that, I wanted to say that YouthLink is really going through, it started with minor surgery, I think, during the COVID, but now we're in major surgery because we're really taking a look at the impact of COVID. And one of the things that we're finding is that the youth themselves during COVID, they started to look for any way that they could hide out. And not having really affordable housing, they started to do exactly what we didn't want them to do, was they ignored social distancing and not believing any of the information and not really understanding the information of social distancing. And so they started to kind of huddle up in unsafe places. And so one of the things that we learned is that we had to increase our mobile outreach. And we are now going to actually take our drop-in and create mobile hotspots in 5 neighborhoods in downtown Minneapolis. And so drop-in is actually expanding to take our drop-in to actually do some mobile intakes and mobile kind of co-responder actions down in hotspots in downtown Minneapolis, because the youth themselves are kind of hiding out. And one of the reasons they were hiding out was they didn't want to be picked up at that time when there was curfews. They didn't want to be picked up by the police. And so we're starting to do, and now that's over, but they're still kind of shying away a little bit. And so we're going to start to do more outreach downtown. But it has caused us to wear PPE gear. It's caused us to have boxed kind of meals. It's caused us to have temperatures when we're out there. It's caused us to do more health screening and ask questions about health. And it's caused us to make sure that we're getting medical referrals when we're out there and getting them into the appropriate places that they need to be. So there's a lot of changes in while we're delivering and what we're talking about. It's not just talking about, are you safe? It's talking about medical issues we're hiring a medical person to go with us in outreach, not just a plain outreach worker.
Interesting. Yeah, thank you. Matt, let me come back to you as well. I think many people, certainly our organization, thinks of you in these terms, thinks of Padilla as really a trusted advisor And one interesting thing that you all have been doing is sort of assembling communication and social media information about sort of communication trends and what people are saying about COVID-19. How has that sort of influenced your advice to your clients and just sort of the leadership counseling that you've been providing during this time?
Yeah, it's a great question. I think the common theme is organizations and leadership are becoming more self-aware. They're recognizing that not everybody thinks, not all their employees or their customers think exactly the way they do. And this idea of getting out of your own head and into the heads of the people who are important to you has become more important than ever. And it's actually created, I think, a more effective pool of leaders. And it's also created more effective communications. And one of the things that's happened is, and this is going to sound self-serving, and it's not intended to be at all, but there's not been a single organization that's gone through the COVID experience or through the experience related to social unrest and the George Floyd experience who hasn't needed to communicate. And as a result, there's more of a recognition on the importance of strategic communications as a tool for helping accomplish business outcomes. And so communicators are now having that seat at the table to advise leadership on what they should say, but even as importantly, what they should do. Now it's up to communications professionals to actually stay there and to keep providing that value, because that part of this is incredibly important. 99% of this sucks for all of us. But there's this 1% of me that says, this is an opportunity for us to all to learn some things that we just would not have had if this wouldn't have happened.
Yeah, interesting. That's important to hold on to that 1%, right?
Right.
9% that sucks.
Yeah, you can have that part.
Yeah. Tanya, let me come back to you and just invite you to talk more broadly about your work. I kind of focused you initially on restaurants because that's such an important part of the Shea portfolio, and you guys have designed some of our best restaurants here and elsewhere in the country. But I know you're thinking about this more broadly. So can you just offer your thoughts maybe on things that you've heard from the other panelists, or just advice that you're giving to your other clients about kind of how to get ready for this period of time ahead of us here?
Well, Matt makes a great point, because I think if we learned anything out of this, it's how to better communicate and to stay into contact and be creative in the ways that we do that and reach out to people. And as I said earlier, to not just sit on our hands. Let's use this as a learning experience. Let's use this to make us better moving forward. So yes, you're right, Steve. We do work, our work is at retail, hospitality, and workplace. So there's different challenges within each of those environments, and there's many of the same challenges at the same time. So you're dealing with people, and you're dealing with people with a spectrum of fear that ranges from those that haven't left their house in the last 3.5 months to those that have been out every day and been out in the world, and we're excited to go back to restaurants. So in every environment, you have to be prepared to communicate to that entire spectrum. And that means, you have to put your own personal beliefs and opinions aside, and you have to really focus on how you can make your employees comfortable, make your guests comfortable, and communicate all of those key points to a variety of different audiences. So, and working across the country, there's different opening dates. So we're navigating a lot of different opening dates, different opening cycles, and different kinds of guests and consumers. But in all cases, it is communicate, restaurants in particular. So I like to say eat and drink for a living, because we do a lot of restaurant design. And I was the first one when they opened outdoor dining to be out there. And I've been in Minneapolis, I've been out eating in a restaurant that's open every night, both to support our community and to see how people are working through. And they're seeing a different environment for now, but they're still seeing some of the similarities and the comfort and the interaction that you love in restaurants. So, and people are being respectful. And I think it's important for people to be respectful and to continue to not, regardless of where you are in that spectrum of fear, to not live in fear, but to live in respect and communications of others. So, if there's things that are uncomfortable, if there's things that need to be worked on, it's important for all of us to communicate that And what we're doing is we're keeping our eyes on everything. Our office included, we use our office as a guinea pig for how to reopen offices. And we did a phased approach, and we published all of our notes of what we did. We've counseled others on it. We did the same with restaurants, and we're learning. Everyone's learning. It changes every day. So being out there and seeing the opportunities and challenges and being able to pivot and deal with those immediately, I think is the most critical thing right now.
That makes sense. Thanks for those observations. Well, I do want to encourage anyone who's tuning in, if you have a question, please use the Q&A function, and we'll get to those questions. But meanwhile, I've got maybe a couple of questions I'd pose to the whole group, and I'll go in reverse order this time. So, Tanya, start with you. I certainly have internalized this message that remote work is here to stay, whatever that means. But so does that mean 6 months, 6 years, or forever? I mean, what's your forecast about how the remote work trend will take hold and how durable it will be?
I think in the short term, for the rest of this year in particular, I think us employers have to be very careful how we navigate what we're requiring our employees to do. And so there's a difficulty in what you're going to allow certain people to do and certain others not to do. I think in the long term, I think employers like ourselves are really looking at our employee base and looking at the space that we have and saying, who can be more efficient, maybe working from home part-time or working from home on a little bit more continual basis. And in a firm like ours, collaboration and communications like face-to-face is so critical. So we're not really a business in an industry that could sustain that long term. However, we do have the production side of our business that perhaps we can give those options. I think every office is different, but I do think what we are going to see, and I think all the rest of my co-panelists will echo this, is everyone is reassessing for both themselves and their clients what can be a little bit more of a long-term option. And if that means saving space in your own office, that might be a little bit more of a long-term shift that we see.
Interesting. Matt, how do you think about that question?
Yeah, I think Tanya said it very well. I think one of the things that I was writing some notes down here, one of the things that I think has happened is that there's been a heightened appreciation for what it takes to be effective working from home. When we had a small number of people from our offices working from home, one of the challenges was always getting those staffers to recognize that it's not just about being available. It's about actually reaching out and being connected and staying connected. Well, when the entire employee base was remote, we all have to work hard to be connected. And that appreciation, that recognition of getting on the balls of your feet and being proactive, if you're in a remote environment, of being in touch with the teams who maybe are physically together, is all the more important. We're going to have a bigger segment of our population long-term working from home, but the expectation of connectedness will still be there. The carbon to carbon contact, there's no replacement for that, but we can compensate for it. Likewise, those who are going to be working in maybe the office setting, but have colleagues who are working from home for whatever reason, whether it's their own personal safety, whether it's family commitments, we've got a lot more understanding and sort of empathy for what they might be challenged with, and a lot more flexibility in terms of scheduling. I'm not holding 3-hour meetings, because I guarantee you the mom or the dad that's homeschooling kids is going to be interrupted with that 3-hour meeting. Let's kind of cut back on those things. So we just have we have a better appreciation for how to make this work in a mixed mode environment.
Yeah, thank you. So Heather, you've got both workers that you have working remotely, service delivery issues. So how do you see this issue playing out in coming months, years?
Yeah, we've been talking about this a lot. We have a kind of a split staff. We've got staff who are direct face-to-face youth workers. And then we have employees that are not. And so that's one of the dilemmas that we have. And the workers that are face-to-face, it's very difficult not to be around the youth. But there are segments of their jobs that they could deliver remotely. So I see it kind of playing out in kind of a mixed bag. And there will be times that we can do remote, and there'll be times that we have to be on site. So I see that, it's going to be a mixed kind of approach to this. I don't think that us going totally remote is going to happen with us.
Thanks. And Brent, I saw an earlier chat from you that this is sort of a 70-30 issue, with 30% saying, I'm just fine working from home, thank you very much. Is that 30% going to be the same number in a year or two, or how do you think about the durability of remote work?
I don't think so. I think remote work was around before COVID, and it's going to be around after. It's going to take on a different flow in a different position. But and again, this is probably more Brent Robertson than JLL. I think, because again, nobody knows. Everybody's crystal ball is not clear as mine. But if you look at SARS in 2002, after 18 months, again, SARS it was more deadly, but it wasn't as contagious. But after 18 months, Hong Kong everybody had amnesia. And I don't think that's going to be the case here. I think it's going to take a little longer. But if you can work from home and you can be productive, you're going to continue to do it part-time for sure, or maybe full-time. For me, I got 2 girls. I got a 4-year-old and a 6-year-old, and I can tell you it's been a struggle for 3 months. But I think in the long term, everyone I talk to keeps coming back to culture and productivity. And you simply can't create a culture working out of your office, and you can't be as productive. I just don't believe someone can be more productive sitting at home with distractions than they can be in the office, and you lose collaboration. I mean, Zoom's great, Steve, but I like, we're social creatures. So, and I think if you want to advance your career, it's hard to advance your career when you're not meeting with people every day, and you're sitting in your home. And I'm going to use this example. I heard someone say, and I'm good friends with Tanya, so I'll use Tanya. If a restaurateur in New York is thinking about opening up in Minneapolis, and they want to hire, they want to interview 3 architects to potentially work with, and Tanya and David get on and they do a Zoom meeting with these guys, and their competitor flies to New York. Well, do you think Tanya's going to be flying to New York, the next time? I mean, and I kind of looked at the same way with employees. If you're the one that's kind of on the outside, eventually you're going to want to come back in to create that culture and have that collaboration.
Yeah, thanks. And Breanna, for a company like Target, I just know from having heard from some of your HR folks that remote work, while it's been productive, creates a number of issues for you in terms of people wanting to work remotely from different states and things of that nature. So long term, how do you see Target sort of sorting through the percentage of folks that might kind of work in this way on a longer term basis?
Yeah, I don't know that what I would have to say differs a whole lot from what's already been shared. I do think that what we've been doing is doing a lot more listening, and the way that HR rules have come out historically, oftentimes it's kind of that top down and everybody must comply, versus what I think we're evolving to is a lot more listening, a lot more internal team surveys, and understanding unique situations and trying to be as adaptable as possible as you can, while also making sure that it's really clear what each individual's goals and objectives are, and are they being met. And at the end of the day, I think it is really important for leaders of people to understand their team's unique needs and be very clear and working closely with each person on expectations for getting the job done. And if it's not getting done, how do you rethink one's working environment to make sure that it can? So I think a lot of this now will just be, rather than high level bottom or tops down, it'll be bottoms up, and an important role for the manager of people to really understand how to best drive outcomes for their teams. And then the other thing I'd share is that it's been really fun to be on calls with leaders, our CEO, and a lot of others who have kids running around in the background, and the same sort of situation that I deal with at home. Yeah. And there has been also historically, you have your work life and then you have your personal life. And over time, we've seen that that's just impossible not to blend, and not to know that people bring their home self to work and their work self back home. And now there's just no way to not have those things blended. And I think that there is just a more awareness and appreciation for what that looks like. And I think that will continue moving forward, no matter where one works.
That's a great point. We've sort of invited each other into problems. And so far for me, I haven't had any disasters. So yeah, we did have one question come in, and maybe we'll answer this and wrap it up for this morning. And Matt, looks like you want to tackle this, and perhaps Brent, ask you as well. Really, the question is, how specific should communications be around what companies or buildings are doing to kind of prepare from a safety standpoint for their employees coming back. Matt, why don't you take a crack at that?
Yeah, it was a good question, Steve. You know, it's how much detail do you get into with regard to the individual, you know, really granular procedures? You know, the answer to that question is think about what you know the employees or the people need to know in order for them to move ahead. You certainly don't want to over communicate, because if you over communicate, you might actually communicate something that has to change. One thing we've seen, well, one big thing we've seen over the past several months is we've had to pivot. What I thought was right on March 1st was different on March 15th, was different on April 15th. So communicating absolutes is a bad idea. But think about why they're asking the question. Is it, you know, if it's related to what chemicals are we using to clean? Well, why are they asking that question? What they're really asking is it safe? Well, that's what you really want to communicate, is we're vetting what we're using for cleaning to make sure it's safe, or making sure that it's effective, not just answering questions and providing every level of detail. It's thinking about what really is behind that question. I think that's probably the most important when you're thinking about communicating the level of detail, is how much do they really need to know in order to be comfortable, and how much can you say without having to backtrack later on. And by the way, I don't know. Senior leaders have learned that I don't know is a perfectly acceptable answer to a question, and get comfortable with it, because that's what we're dealing with. And thinking that you always have to have all the answers is just an unreasonable expectation.
Yeah, good point. Brent or Tanya, anything you'd like to add to that topic?
Matt answered it perfectly.
Okay.
Everything he said, I echo that.
Great. Tanya, you agree?
Yeah, I would agree.
Okay.
Asking for very specifics, again, it's coming from a place of fear, and they want reassurance. So I think regardless of what environment you are in, whether it's restaurants or office space, I think showing that you're taking guidelines seriously and that you're abiding by them and you're paying attention to people wanting to be safe, I think those messages are a lot more important than what cleaning supplies you're using.
Great.
Steve, if I may, at Target,
Sure.
I think last week it was, maybe 2 weeks ago, we have a return to office guide that's online. And the nice thing, it's available to our team members. And as things adjust, it can also be refreshed and updated. But it includes a variety of topics, like things that you should be thinking about before you arrive at the office, what traveling to the office might look like, entering the Target headquarters building, while you're in the office, before you leave the office, and additional information. It kind of walks you through all the things that you may want to expect and things that you should be preparing for before you get in. And that can continue to be updated as we work our way through the pandemic, because it's available online. But that, at least while there's a little bit of ambiguity about the when will I be going back to the office, it's pretty clear that when I do, here's what I can expect. And so I've appreciated the degree of transparency that's been shared with us.
Yeah, that's helpful. And we haven't even talked about that aspect of return to work that's outside of the building or the office, especially for those folks that are transit. And we've been working a lot with Metro Transit on that issue. So a multi-factored equation here, and you all have provided much information that's very valuable. So thanks to all 5 of you for taking the time to be on this panel this morning. Very, very helpful. And thanks to everyone who and hope to see you at some of our future programs coming in. Have a great rest of the day. Thanks, everybody.
Thank you.
Thank you.